This is Gifty, and I am the founder of Baller Mom. So welcome to everyone that's going to be joining me today. I have another special feature with my feature series, and I will be featuring Dr. Nekessa Remy. She is a well-known, board certified chiropractic acupuncturist. She'll be telling you who she is, but the focus today is to talk about athlete preventions and injuries, and even parents, or even for ourselves, how we can continue to take care of ourselves physically so that our mental and our ability to continue to move forward post-COVID or whatever we're trying to do can always be positive. So thank you for joining. Allow me to now add Dr. Kemi to join us and introduce herself. And hopefully everybody's having a pretty good day or good week so far. Good evening, wherever you may be, or whenever you get a chance to watch. Hello there. How are you?
Hey, can you hear me okay?
Yes, I can.
Okay, good.
Yes. Yes.
I had to do the earplugs because my daughter is not sleeping yet. So
okay, hey, how are you?
Yeah, so we'll see how it goes.
I had to close the door too, so I can knock the noises out. So don't worry.
Okay, good.
Working mom, it's okay.
Right, I'm hoping Peppa Pig on the screen will help.
Oh yes, I remember Peppa Pig and Mama Pig. Oh my. Fun times.
Yes, a lot.
Yeah. How is everything though?
Everything is good. It's busy, but it's good. Yeah, I can't complain. Everyone is healthy, happy, so I'm good.
Nice. And so I just wanted I did a little intro as to who you are. But with those that are watching now, I put it in a topic. It's mainly we're focusing on physio, health, injuries. We're sports family. We're sports moms. Soon I'm sure your daughter will be doing some type of sports too.
Definitely.
If you can take a moment and introduce yourself to the audience, that would be great.
Yes. So as you mentioned, my name is Dr. Nekessa Remy. I am a chiropractor and acupuncturist, and I currently own a clinic in Mississauga. It's a multidisciplinary clinic. And one of the reasons why I wanted to work with you and meet with you is because this past year, since the pandemic, I have been treating more and more kids than I ever have. Wow. Ever. In the 14 years that I've been doing this, I've never had so many kids in my practice. Wow. And part of it was the fact that kids were at home. They weren't active, right? They were sitting for longer and longer periods. And it doesn't matter how fit you are, how young you are. We're not designed to be sitting at computers all day long. So I was getting a lot of kids coming in with like postural injuries. And then now everyone's back into sport, but they've been sitting for, a year.
For so long. Yeah.
Right? And so now I'm seeing different kinds of injuries. And my whole thing is the reason why I do anything that I do, whether it's treating patients, media work, workshops, it's all about prevention, because I think prevention is so important. So educating kids, educating parents on what to look for, what to do, is something that is it's high on my priority list for sure.
Oh my God. It's such a good thing, because even from my perspective, I mean, we've been in sports for a while, and I think I messaged you at some point about growing pains, like when they get to a certain age and they get that I forgot. Like,
Osgood-Slaughters.
Well, you're the doctor, so you know how to take it.
Yes.
That pain, that growing pain of the knee and the height that they're getting, and not being able to still be as active as you want to, but you also want to return to it, but without injuring it further. And going through that it's crazy. It is.
It is. And as a parent now, I really think that sometimes you can't do anything about it. And that's hard as a parent. Like when your kid is in pain, you want to fix it. But sometimes, there aren't things that you can do. And hopefully that's kind of what I can help parents with, is to identify certain things, know when you might need to see a practitioner versus where maybe your kid just needs to rest 24 hours. That's kind of what I'm hoping to do.
Oh, good. And, I think it's a great thing, because I've always wondered, like, there's coaches, there's trainers, and then we need like an actual physician, somebody who specializes in the bones and the body and the movement. So at your current practice, do you work with any particular clubs or leagues or
Mm-hmm.
trainers in helping with the prevention aspect of it?
So yeah, for a lot of years, I've worked with like the Brampton Rebels soccer team. I've worked with the Mississauga Warriors, the football team, the Oakville Titans. So over the years, I've done a lot of stuff. And recently, as you may know, I'm working on the mentorship team for the Harris Brand Foundation.
Yes.
And that's reaching out to
his team.
Right, exactly. They're doing amazing work. I'm so happy to be part of that organization. And yeah, we're really looking at spreading the word. And I know you sent over some questions, and one of the answers I wanted to say this was, you know, I think sports teams, clubs really do need to invest, like you said, in having someone who focuses on the injury. Coaches know a lot of stuff, don't get me wrong. Trainers know a lot of stuff. I'm not saying that they don't, but I think it's important to have someone who can talk prevention. Right? Or preseason, you know, there's all these tests that I used to do when I was working with teams, functional tests, where you can look to see, oh, this kid's one shoulder is moving more than the other, or one knee is less flexible. Like, you can identify things pre-season so they have things to work on so that they're not getting injured, right? So that's really what I want to do, is I want to reach more teams in that pre-season kind of area to help kids prevent injury, really, is what I want to do. Yeah.
That's amazing. So in that case, you will be part of their practices, their little scrimmages, and you just kind of assess each individual athlete, let's say?
Like I did that, I can't remember. I did it for a basketball team many, many moons ago. And that's what we did. Before their season started, parents came out and I tested. There's like about 4 or 5 tests I put each kid through. And it just gives me an idea of what's going on. And the parents are there because parents are so key to this. And I'm explaining to them, okay, your child looks like he doesn't have a lot of flexibility in his ankle. You know, that's not good because he's playing basketball, he's jumping a lot. Achilles injuries, ankle sprains are common. So here are some things that you might want to talk to the trainer about, or things you can do at home. So really, yeah, I would love to do that, to have the time and the space and to do that.
And that's great. So to all of my club owners and coaches and trainers that are watching, you definitely want to connect with Dr. Remy, because she will take that time. You can focus on the skills and all of that you're doing. It's amazing. But when it comes to body structure, making sure that each player is coming top notch and knowing when to put them in, when to pull them out, and things like that. Right. Definitely work with her, because that is something that we need. Even as parents, we're sitting on the on the sideline. If somebody falls, you're like, ooh, are they okay? Right. You're limping a bit, but still in the back of your mind, you're wondering, okay, are they going to go check it out? You know what I mean? Because sort of teaching them play through pain, but what happens after the pain and the treatment on it. So give me an example of, let's say, a child, let's say someone who's 12 years old, they've been playing for maybe 2 years now, and during an actual game, they kind of fall a little bit and then they shake it off. But you can see through the middle of the game, they're still limping a little bit. Like, what would you, without not even seeing how their structure is or anything like that, from a parent's perspective, what would you recommend, like, after the game, coming home to make sure that their body is okay and ready for whenever the next game is?
Now, sometimes I'll admit maybe I'm a little too cautious, but if I see a kid who is playing and not able to perform the techniques properly, I'm going to put a stop then and there. Because the thing is, if you're limping and you're continuing to play, you're putting yourself at greater risk for more and more severe injuries, right? So that's why it's always great if teams are able to have that kind of kinesiologist, athletic therapist. A lot of teams will have somebody on the sidelines who can get to those acute injuries right away. So if your team is able to do that or have access to that, highly recommend it, because we don't want, I understand this toughness, this mentality, but you got to work through the pain. I don't like that. I don't say that. I would never say. But I've seen it in practice. I've seen the 35-year-old, 40-year-old guy who comes in with hip arthritis because he played hockey for 10, 15 years and never had his injuries assessed. And now at 40, he's got arthritis in his hip. Like I've
Wow.
seen it. I've seen it over and over and over again. And so I think it's so important to educate kids that, hey, when you're feeling pain, stop. That's your body's way of saying something is wrong. I need to stop and assess it. Pain doesn't mean you're never going to play again. It doesn't mean that, you know, you're going to lose your position. No, it just means your body is saying, hey, hold on. I need to assess something here. Something's not right. So if you're a parent and, you know, your kid gets injured during the game and you're not sure, what do I do? What I would always say is if they wake up the next morning, if they have pain for more than 24 hours, get it assessed, okay?
Okay.
Stop playing, get it assessed, okay? More than 24 hours, get it assessed.
Okay.
If within those 24 hours you notice swelling, you notice bruising, or pain is increasing in intensity, maybe don't wait 24 hours. If you have access to a chiropractor, physio, whatever, get it looked at sooner than later, okay? But yeah, bruising, swelling, increased pain intensity, redness around a joint, all those things indicate that there might be something acute, inflammation, strain, possibly a fracture. So you want to get that stuff assessed immediately.
Okay. Okay. And when it comes to assess, because, you know, I can go to my family doctor, they can assess it. I can go to a walk-in clinic and they can assess it. What does the assess mean? Like, which type of medical level of experience should we be thinking of? And especially in COVID right now, where a lot of them are doing virtual. They're not even looking at you physically to even express where the pain is, right?
Yes,
so
and I have a lot of issue with that.
What care should we be thinking of to take them there to get that assessment?
So if it's like something, a medical emergency where there's like bleeding or something, or an ambulance called, obviously hospital, ER, do that. But let's say it's a little limp in the ankle. If you have access to a chiropractor or physiotherapist or athletic therapist, somebody that can actually examine your kids, do that. Because right now, chiropractors, physios, all of us, we're doing in-person treatments, right? We've been doing it since, oh God, we haven't really shut down. We've been open and we've been seeing patients to do, in-person assessments for this whole time. So if you have, and that's something I would recommend to parents too, is have somebody in mind maybe before your child starts their season. So that way, you know, if there's an issue, I can call so-and-so right away. I'm not Googling, I'm not asking people. I have somebody, you know, on my speed dial that I can call. But yeah, get the in-person assessment. And you're right, with medical doctors right now, it's a lot harder. And I don't know how much they can diagnose over the phone. Not only that, you have to look at medical doctors, their skills are in prescribing medication, prescribing imaging. They're not going to sit there and feel a muscle and see the joint. That's not what their skill, that's not what they're trained to do. So if you have a joint or sports injury, muscle injury, I would highly recommend seeing, physio, sports massage therapist, even like go see someone. Go see someone in person. I think it's so important to have that assessed sooner than later.
Okay. So now that's about somebody who may have a little bit of injury. Now, what about the athletes where they don't experience any injury, but they're continuously actively moving, you know, so there's a little bit strain on the muscles. There's no injury, right? Do you recommend like a regular treatment or assessment on a consistent basis just to keep the body moving? Because it's like, well, nothing's broken, so why even need to go and see someone, right? So it's for a parent's perspective, like, is that something that's also we should be considering? Yes,
it's just like you have to change the oil in your car every so many miles or whatever. Your body needs an assessment every so many miles as well. So most of my patients, I want them coming to see me once every 4 to 6 weeks. Now the other thing too about having a physio, chiro, whatever, is a lot of times I'm giving these kids homework, right? I'm saying, listen, your hamstring injury is reoccurring. I want you to do these exercises. So they can now identify, you know what, my hamstring felt a little off during the game. Let me go do those exercises. And then maybe they don't even need to come in and see me at that point, right? So I think that's why it's really important to have that assessment, that in-person assessment done. Like at the beginning of the season, okay? And then that way, you know, any stretches or exercises that your child can be doing, they're doing, and you don't need to come in for that, right?
Yeah.
So, sorry, I feel like I'm talking all over the place, but yes, okay, good. I'm so passionate about this. I'm so passionate about this.
That she highly recommend the Hive Toronto, where her baby has been seeing them for years. So good job. I mean, there are parents already taking that initiative, and that's something that is good to continue, because it's supporting their body for the rest of your life while you're active and after. Like you said, person played hockey for so many years, you're no longer active, but now they have
other
to deal
things
with the after effects.
Yes, right? Exactly. And I think too, like, even depending on, I guess, the level that your child is competing, not everyone has access to like off-season training or things like that. And so that's also where a chirophysio can come in handy, is because they can be guiding you through things that you can do during your off-season to prevent a lot of these injuries. Or if you're dealing with a nagging kind of injury, comes and goes, it's maybe not severe, but it comes and goes, you know what exercises you should be doing, things to avoid, stuff like that. So I think having some type of therapist, like I said, in your speed dial, circle, and maybe seeing them once every 4 to 6 weeks, let's say, is beneficial. And also too, children are growing, and as they go through different stages, certain body parts can be affected, and that can change the way they play as well. So you want to also educate your child, or educate your patient, your child, so that they know what to expect, right? They know that, okay, going through a growth spurt, so yes, my knees might hurt, so yes, I need to ice or do whatever, right? So I think it's important to have some type of therapist in your circle, for sure.
I agree. And then, again, someone's giving you great kudos, saying, 1 ounce of prevention is better than a pound of cure. Yes, and definitely.
I'm taking that. Let me write that down right now.
And that, she's saying you're an excellent. So definitely another, another client that knows, or speaking from heart, exactly the work that you do and what you're doing to help your child to continue to be healthy physically. Now, with prevention, I mean, these are moving and stuff, right? And both sports, basketball or soccer, they're contact sports. You're moving. It's like you're body checking. You're doing all of that. And of course, everybody joining and doing it also want to look good. So when we look at the game and the things that they have to wear, one of them is shoes.
Yes.
So what role does selecting the right type of shoes play in even assisting with the type of injury that they may have to deal with?
Any type of equipment, you want it to support you or to protect you. Like, that's the job, support and protect. If it's not doing those things, you are going to be at greater risk of injuries. So depending on the sport, you want to make sure, obviously, that you have the right shoe for the sport. Like, that's important, right? And I think proper fit is important. Materials can sometimes be important. But like basketball, for example, you want to make sure you have a basketball type of shoe. Now, there's even like some talk, not a lot of research, but there's some talk even for like the different positions, what type of basketball shoe for each position. Like if you're, like someone who's playing like a center or power forward, there may not be moving quite as quick as like a point guard, let's say. They want to maybe have like a higher top or a higher upper is what it's called, the height of the shoe, versus someone, who's playing like the one position or point guard, they're moving more, they can get away with like a mid to lower cut. There's some research on that, not a lot, but you want to make sure that when you're looking at shoes, you go to the right sport. The other thing too is you want to make sure they're the right fit. There's no such thing as breaking in a pair of shoes. That's a myth. That's a myth. Okay? Shoes need to feel comfortable from the moment you put them on. If they're not comfortable, they're not the right shoe. So for kids and for adults, I always recommend purchasing shoes like later in the afternoon, because our feet actually expand throughout the day. So you don't want to wake up right away and go buy shoes, because your feet might actually be a little narrower. So wait towards, the afternoon or the end of the day. Another thing that you can do is a lot of running shoes, maybe not soccer shoes so much. Soccer shoes, hockey skates, they tend to fit a little narrow, so this may not work. But basketball shoes, the insert of the shoe can sometimes come out.
Yeah.
So what you can do if your kid is kind of like, oh, I'm not sure, and as a parent, you know, or as a child might not be able to explain depending on their age, oh, I need to break it in, like they may not know. So what you can do is take out the insert, okay, put it on the ground, and then have your child step into it. If their toes are like, if their toes are right at the very edge of the shoe, the top part of the shoe, maybe you have to go up a size. Or if their feet are spilling over, like outside of the insole, the width might not be right. So that's another trick that you can use for proper fit. And I guess with sports, it's different. I know some parents, shoes can be expensive and you want to buy a bigger size because you know your kid is growing. I get it.
Yeah.
I get it.
They
but
grow
you
by
have,
the second.
Right? I know. But you also don't want the shoe to be too big that they're not offering support. So if you look at like the top of the shoe, so the front of the shoe and your child's longest toe, it shouldn't be more than like the width of your finger, okay? If it's like wider than the width of your finger, that might actually be too big, and your child's foot can move around in it, and especially if they're doing something like basketball where there's a lot of quick movements, you don't want their foot moving in the shoe because that can lead to injury.
Okay, so more like it's just a finger, like a tip, a little bit space.
Like the width, yeah, that space, this amount of space, yeah.
Okay.
If it's too much wider than that, their foot can move quite a bit. And we have to be careful.
Though, because when they're taking the insoles out, when they're playing games, they're wearing socks.
Yeah.
Should they be wearing the socks and then putting the feet on the insole outside the shoes?
Yeah, I would. I would, for sure.
Because that I guess that would give it more realistic of how it will be when they're
exactly.
Okay.
Exactly.
These are good tips. I learn something new every day. I feel like
I love it.
Check it out and just
I love it.
And just, try it out.
And if your kid wears orthotics, make sure to bring the orthotics with you when you're trying on shoes so that you can put the orthotic in the shoe to make sure it fits well.
Because I was going to ask about orthotics too, because they're specialized for each particular feet. And should we be buying the shoes to meet that how the orthotics have been cut?
Yeah. If you have an orthotic that you're already wearing, yes, you want a running shoe that's going to fit the orthotic. There's lots of, I can't tell you specific brands, there's way too many, but there are a lot of orthotic friendly shoes. So what you would do is, in this case, take out the insert of the shoe and then put the orthotic in the shoe to make sure that it fits. And then your child's foot would go in the shoe to make sure it's comfortable. Yeah.
Oh, wow. Like, these are great tips. Like,
awesome.
Like 5-6 years ago. Oh. Like, what do we do? Because you're trying to, the myth about growing into, I've been one of those, like, oh, you're going to grow into it. Because you don't want to keep going back to the store.
I know.
And after being home for like 18 months, half of the shoes don't even fit when the season's starting. And you're like, oh, okay. I mean, we grew this way, we grew that way, but it's a quick thing. It's a quick thing. Now, when it comes to the shoe materials, because with basketball shoes, there's some made soft, and soccer, they have the cleats where the front part is a little bit harder. So should we take those into consideration as well, too? Because I know you say, measure like the tallest toe,
right?
The measurement aspect of it, but when it comes to the actual material, because some of them are hard to even put the feet in. It's made to look nice, and it's made to play, but trying to get the feet in, the shoelace, and all of that. What would you say on that? If
it's too hard to get the foot in, it's not a good material. You want something that's I think basketball shoes are now almost like a combination of like a mesh and a leather. Like they do combos. So that there's some sturdiness, but also breathability. Yeah. When it comes to cleats, they're going to be a thicker material. Yeah. But what you want to make sure of is if you bend the toe of the cleat, it should bend very easily. Okay. I'm wondering, Zemi, can you bring mommy a shoe? Can you bring mommy her shoe? Hopefully, maybe she might do this. I don't know. Bring mommy her shoe. So cleats are going to be, oh, thank you, baby. Thank you. Oh, she's so good. So this part here, in the cleats, right, the material, like this one is all mesh. This is soft. A cleat, this is probably going to be more leather. But you should be able to bend here really easily, okay? You may not be able to bend in the middle, like this shoe, but on a cleat, this needs to be very flexible, okay? Because your child is going to be pushing off, toeing off, jumping, so that running, so you need to make sure that that part of the shoe is flexible.
Okay. Now there's a question about brand recommendation. Is there any particular that, I mean, without any affiliations or anything like that, do you have any?
It's too hard, to be honest, to recommend a brand, because within each brand, there's so many different types of shoes, and it's not a one-size-fits-all situation at all. The best thing to do is to look at the features of the shoe. So cleats, for example, I think most cleats now are plastic cleats, but you want a plastic cleat, not a metal cleat. The plastic cleats are thicker, right? And that's good, because it means that your child is going to have like more stability, right? Different brands will make different types, but you want to look for a thicker plastic cleat. And again, you want to make sure that there's bendability, flexibility at the toe. So whichever brand offers that for you, go with that. And with basketball shoes, one thing you want to look at is the cushioning. Like there should be some gel or some cushioning, air, whatever in the heel, because kids are jumping a lot, right? So you need cushioning. The other thing, oh my God, sorry.
That's okay, don't worry.
Difficulty. But yeah, I'm going to show you one thing about a shoe, okay?
Okay.
All right, let me just plug this in so we're not listening to Peppa Pig. So you see this part here?
Yeah.
Okay, so in a basketball shoe, some of them will actually have like an extra padding here. What that does is it holds the Achilles tendon, and it gives the Achilles tendon a bit of cushioning. So for kids that are going through a growth spurt, for basketball players, because they're always jumping, look for something that has a little extra, like, it looks like a little half circle in here. That's really good for basketball shoes. And again, lots of brands will have it. So just look for a brand that has it. Thanks, Emmy.
Oh,
thank you.
These are really, really awesome in there. Now, when it comes to going back to the injury aspect of it, though, what should we be watching, right, when it comes to the whole prevention? Because we want to make sure that, like you said, you want to work with the teams pre-season. They're running, they're going up and down, and especially for basketball, like they're hardcore outdoor, indoor is good. Different courts have different ways on it. So in terms of the shoe wearing and the training aspect of it, should they be switching depending on what court they're on to help them out?
Not really. I don't think it matters too much unless they have serious like Achilles issues or ankle issues or foot pain. Then maybe if it's a harder surface, you want something with a little additional cushioning. But otherwise, that's not going to be as huge an issue as properly warming up. That's a bigger issue. That's more important, right? Making sure you're doing more dynamic stretching before you play. So before you play any sport, you're not sitting there holding stretches for 30 seconds. You're preparing the body for movement. So stretches are going to be quicker. After you play, you got to stretch. That's where you're going to do more static stretching. So that's where you're holding stretches for longer periods of time. So things like that are more important than, I would say they're more important than footwear and surface. So those are things that you need to make sure that your child is doing properly, hopefully with the help of a team trainer or coaches that are guiding them through that to make sure that they do it every time they play.
Great. And I know some shoes, the weight of it. Some are very light. Some are very heavy. So also, what role do they play? Because it looks nice. Most often you're buying it based on look or what advertising was showing there or what your money can afford at the time. Right. But the functionality also needs to work. So one of it is the weight. There are some that are very, very light. and there are some are very, very heavy. How, like, what's your take on that?
You don't want anything that's really, really heavy, because that's just going to add to the amount of pressure going through the joints in your foot and your ankle, knee, all that kind of stuff. So you do want to stick with lighter weight stuff. Lighter weight stuff can still be supportive if it has the right features, but I wouldn't recommend anything heavy. I don't see the benefit in it, really. If you have the only time shoes might get heavier is for people who have very flat feet, because the insole of the shoe might be a little bit thicker. Let me just show you. This inside part might be a little bit thicker for somebody who has flatter feet, so that might add to the weight a little bit, but when in doubt, go with lighter weight.
So determine the type of feet, though, because for some of the parents, this will be like their first time playing rec or even doing housekeeping. And you just go to a store, they look nice, they buy it based on their, the most famous athlete brand, and then buy it and they go and play. Without even us knowing what type of feet our child has, because we're just going by looks, right? Part of your work is, I guess, helping determine the foot size of it. So if I was to reach out to you saying, hey, Dr. Remy, I want to be able to buy these shoes for my child, but I don't know if it's the right feet for their foot. And let's say I'm not able to come in person. What are some of the techniques that we can do to determine if it's flat-footed, curved, or whatever the different terminology is, so that we can use it to buy the proper shoes to help them?
It is a little tricky to do on your own, to be perfectly honest with you. And it's sad. Like, I went to a big box store not too long ago because I was looking for running shoes for a segment, and the guy had no idea. Like, I was like talking about a pronator, supinator. He really didn't know. And this is a guy that's helping people buy shoes. So that's really one of the things. My goal is to partner with this particular, I'm just going to call them out right now, Sport Check. You need to partner with me, because I can't tell you how many patients come in with pictures of shoes on their phone from Sport Check. Like, should I get this one for my feet? Right? Because it doesn't tell you in the description what you need for what type of foot, right? So I think these stores really need to look at how they can educate people to find the right shoes. That's me on my soapbox.
Expertise in there, or some sort of a chart that you
chart something, because they don't have anything. The staff is not trained at it, and that's not good. So the easiest way I can think of to describe this is, if your child has like very flat feet where they don't have much of an arch at all, like the arch actually falls inwards, then they need what's called a motion control shoe, which is just a shoe that's going to prevent them from rolling in. Okay? On the opposite end of that, if your child has extremely high arches, or what you might notice is the outside of their shoe wears down quickly, like the outside being like baby toe down, wears quickly, then they might be what's called a supinator. And then they would benefit from shoes that have more cushioning. And then if they fall somewhere in the middle, then maybe they just need like a neutral kind of shoe or a stability type shoe. So flat arch or rolling over arch, they're called pronators. The opposite, the high arch rolling to the outside of the foot, they're called supinators. So those are the two extremes. And it's not to say one is bad, one is good. You just want to make sure that you have the right shoe for your foot type.
Now, is there a way for unique individuals who have different feet size? So, one may be a little bit bigger, one may be a little bit smaller. So when we're trying on shoes, which foot do you recommend the most? Like the dominant one, or do both, just so that you can...
No, if you have one size that's bigger, fit the bigger foot. Because the smaller foot, you can kind of add sometimes, like, go to Walmart, get a little insert to put in it or something like that. So you want to fit the bigger foot first. That's going to be the primary foot to fit. I mean, and it's unfortunate because, brands, they all have their guidelines for sizing and things like that. But fit the bigger one first.
And then we got, so just the picture here, we got the right feet, we know the size, we got the right shoes, we're pre-starting, the season, doing some training, stretches, seeing, a specialist with that. When it comes to massages and chiropractic, and I think at some point you had posted something about, why athletes need chiro. What age should they be starting? Because like a 5-year-old or a 6-year-old, or is it 10 or 11? Like what's the appropriate age to get them into that particular physiotherapy to help their body?
To be honest, you can see a chiropractor from an infant. Like there are benefits for chiropractic. But in my singular practice, once a child starts walking, we can do assessments and things like that. So there really is no age limit. You can pretty much go anytime. So as a parent, if you have a concern, you can definitely take your kid. I can only speak for chiropractic because that's what I do. Physios might be a little different, but for chiropractic, yeah, you can start from birth. They can literally start to see chiropractor. Yeah. But for me personally, I wait till once they start walking. That's when I'm more, comfortable, and that's where I would start my assessment. So at any age, whether they're playing one sport, 2 sports, no sports, you can definitely have kids assessed. Yeah.
Okay, great. And for adults, especially parents, I mean, for the 18, almost 2 years that we've all been home, we became very dormant.
Yes, yes.
Glued to the screen, and I think you have a program, which is the proper posture program. So if you can speak a little bit on that for us, because I know we're talking about athletes too, but if we're concerned for them, we also have to, take it. And I'm guilty of it. Verbally, I say it, but I don't always physically do it. I think my brain does more exercise than my body, to be honest.
You're not alone. You're not alone.
It's weird. Only if you can think it and lose it, that would be so awesome.
Right? Oh my God, I would look amazing.
So what are some of the things that you can tell us that we can do? Because if they see us doing it, they're more likely to emulate and do the same thing. It's not more so like I'm telling you to do it because you're an athlete, but look, I'm doing it to make myself, my health good. Let's do it together. So what are some of the tips that we can do?
So the whole thing, the program that I created, the Better Posture program, all came from this pandemic. Like it's insane how busy my practice was just because people were sitting. And it got to the point where I was like, I'm repeating the same things over and over again. I need to create a program so that I don't want patients saying, oh, well, it's hard for me to get here. Good, hop online. We can do this online. Like I'm so tired of treating neck pain, headaches, hip pain, all from people just sitting all day long, right? Yeah. A couple things. Number one, you have to get up every hour. Set your clock, set your watch, set a timer, whatever. Every hour you have to get up. Even if it's just for 10 to 15 seconds, it doesn't matter. But every hour you have to get up. That's number one, okay? Okay.
So now, hold on. Get up as in like just stand up, or
just stand up.
Walking or
walking. The more movement, the better. Okay. But let's say you're on a call, you're on a Zoom call, you can't start stretching. You can just literally stand up. Like just stand up. That's good enough. That's number one. Number two is, sorry, my daughter's like tripping on the vacuum. It's funny.
That's okay.
And then number two is you have to, now when it comes to moving, because again, I understand people are on meetings all day, maybe they can't get up, you can stretch at your desk. So you have to look at stretching your neck and your upper back and your hips. Those 3 areas, if every hour, every 2 hours you do a stretch for each of those areas, that will be helpful for you.
Okay.
Okay.
Wow.
Neck, upper back, hips. And there's a gazillion things you can do. You can do your neck, upper back. You can do like a cat camel for your hips. You can cross one leg over, lean forward. There's lots of stuff that you can do at your desk. But those 3 areas you want to stretch as much as you can throughout your day.
Okay.
And then the last thing is just setting up your workstation. Don't work from your bed. Don't work from your couch.
So
don't work. No, because I don't want your kids doing that. But yeah, have a workstation set up. You don't have to buy expensive things. You can, grab grab some textbooks and raise your laptop on a textbook just so that it's at a better height and you're not looking down. If you're getting wrist pain, roll up a towel, put it under your wrist by the keyboard so you have some support there. Like there's lots of things that you can do just using DIY stuff. And that's all what the course is all about. It's about addressing those three things. Getting up, how to move properly, and then setting up your workstation. Because good posture is not sitting up straight. That's like a small, tiny portion of what proper posture is. Proper posture is from your head all the way down to your toes. And that's kind of what the program takes you through. It's head to toe movements, easy movements that you can do with a towel, a tennis ball, a hockey stick, like easy stuff that you can do on a daily or weekly basis just to help improve your spinal health. Oh, wow. So with sitting down, because now school has opened, not every kid is home doing it online. Majority are going back in class. The majority of them are also after school. You have practice, you have games, you have something like that. What are some of the things that they could be doing in class safely, you know, because chairs are still situated in the way that they have their distance, that they can still, you know, be mindful and maybe lifting their feet up while they're in class to sort of keep your body moving so they're not idle. Because I think they sit in class for about 6 hours altogether with like half an hour or so of recess. And knowing that they have practice that night or they have a game that night and they want to get their body ready, what can we tell the kids? Like, hey, when you're in class, yes, the teacher's teaching, you know, you're listening and everything, but still do something, because I'm getting up an hour at home. You're in class. Don't disturb it. But what else can they do in a respectful way to still keep your body ready for whatever's going to go on after school? So the same stretches that I was talking about, the neck, upper back, hip stretches, all of those you can do in your seat. You don't have to get up to do those. And they can do the exact same things. I mean, I would hope teachers would kind of understand the importance of movement, right? Kids especially are designed to be moving, not sitting for 6 hours straight, right? Like it's just, it's impossible. So yeah, I really do think that, just sitting and doing a couple neck stretches, upper back stretches, rotation, hip stuff while at their desk will just help to keep the joints lubricated and kind of get them somewhat ready for activity later in the day. Oh my goodness, these are such great tips. And again, I just wanted to just read out what some of the comments were coming in. So Mr. MH Scott, he's saying great insight, and he wants to connect with you afterwards to also do this podcast. So I will connect with two of you for sure. And his audience is in this US. So, but body is body regardless of where you're at. Athletes and athletes regardless of where you're at. So all the information here will definitely help out. And everybody else that's joining, again, if you have any particular question, even if it's related to your own child, making sure that you can help them prevent any injury while the season is about to start, please do share, comment it, ask out. Dr. Remy's here to provide that information and help. One of my moms said, say that these are great tips about shoes. Yes, Tanya, it's true. Because we both have gone through the process of get ortho and the growing pains and things like that. Now, touching on the growing pains, especially, and I think mainly males experience that growth spurt when it comes to the knee aspect of it. So what are some of the key things that we should be looking for, knowing that it's not injury based, it's a growth spurt or it's a growing pain, and how we can help them still treat it without straining any further? So yeah, what you and I were talking about earlier was the Osgood-Schlatters. That's the most common type, and it happens in the knees. And what you might know is like there's a little knob below the kneecap. Yeah, the little tubercle there, or tuberosity, that can sometimes get, because Osgood-Schlatters is almost like your bones and your muscles are growing, but maybe they're not growing at the same time. And so that creates a bit of friction. So icing the knee is always a good thing to do if they feel pain. I wouldn't recommend heat on the joints. I would recommend ice. So if they, so if they're complaining of pain, and especially that tenderness underneath the kneecap, get a gel ice pack, not a hard ice pack, get a gel one, and you can wrap it in a towel and then place it on the knee. 15 minutes on, 15 minutes off. Okay, that's number one. The other thing too is it might mean not necessarily stopping all activity, but you might want to look at maybe instead of doing back-to-back days like Monday, Tuesday, maybe give yourself an extra day in between just so that you have a little bit more recovery time if the flexibility is there. The other thing too is the stretching, which is very important. Hamstrings need to be stretched. Calf muscles need to be stretched as well. Very, very important. And lastly, the quad muscles, which are the ones at the front of the knee. So when you're doing your stretches, and these should be done daily, pain or no pain, you need to do these stretches.
So for the kids who are watching, pay attention.
Yes, they need to be done daily. Okay, and if you can do them like 3 times a day, morning, afternoon, evening, even better. It will help speed up the recovery process. Okay, but yeah, you want to be doing those on a daily basis.
What about protection, like knee protections or elbow protections, like the extra things that you can put on, like knee pads, elbow pads, anything, compression chair and all of that stuff? How, like, should we let them use those as well too?
I don't necessarily know about anything. I wouldn't probably do anything compression related. I mean, again, I should preface all of this by saying you should be assessed and diagnosed first by a healthcare practitioner. Don't assume that anything is Osgood Sauter's until you actually have it diagnosed. But
it's a long process, trust me.
Yes.
So we've been through it.
But yeah, you can do like the knee bands. I think they're called, what are they called? There's a name for them. They're just like a little thick band. You can get them at the drugstore. I'm drawing a blank on what they're called, but they're just bands, elbow bands, knee bands. You can get them anywhere. And you can place those just below the tuberosity, below that little, the pointy bit below the kneecap. You can put it under there. And that's just to kind of alleviate the tension on the bony part there. It's not something you want to sleep with, but during the day, if they're walking to and from class or walking, you know, to school, maybe they want a little bit extra support, you can use those for that purpose.
And speaking of equipment to use, I mean, when let's say you go to Winners or you go to Homesteads or you go to the health sector or section, even sports training, there's a lot of different things that's out there to gear towards you to getting better. So like a roller or a ball or things like that. What are some of the things that, depend on what type of sport you're doing, are good and what you should get in for the body part? Because do I just get a roller and use it on my back? Is it good for only when my calves are hurting? Is it only when your arm is hurting? Like, what are some of the day-to-day or simple equipment that could be used for, regardless of where the pain is that you're trying to prevent that injury?
Oh my God, get down. Sorry, she's on the coffee table now. Get down.
Bring her in.
She's proud. I like the idea of the foam roller, to be honest, because you can use it for any body part, like legs, back, shoulders. You can use it for anything. So I highly recommend a foam roller, and it can be used. Yeah, the foam roller. It can be used by kids and adults. So that's one of my favorite tools to have in a home gym, if you will, because there's just so many things that you can do with it. So foam roller for sure. I would recommend investing. And nowadays you can even just go on YouTube and look at, you know, foam roller quads, foam roller hamstrings, and get a gazillion exercises and stretches that you can do with the foam roller. But I really like the foam roller. I think between that and even like a tennis ball to help with like muscle release, those two things I think are great to have, and they're not that expensive either.
So these are probably something they can still keep in their backpacks in between games or in between practices.
Well, I would do it after, especially the foam rolling, because the foam rolling is going to be uncomfortable. So you may not want to do it between sports, but after, when you're done, I would use it. And afterwards, in terms of treating the pain, is it more heat or cold should they be using? I would say cold.
Cold. Okay, so it's always better to use
when in doubt, use cold.
Cold. Okay. Okay, so these are good points because sometimes you want to go by that 8535 because it's hot and you want to rub it on and say it's okay. You know, trying to get the pain down.
Within the first 24, 48 hours, just stick with ice.
Ice.
On cold. Yeah.
Okay. Okay. Oh my God. These are such great tips. Oh my goodness.
No, oh my goodness. This child is going to Zemi, she has my lipstick and is now putting it on her eyes.
Oh, you know what? She's starting to make up artist, Zemi, so that's okay.
Yes, Zemi, come here.
That's fine. But without taking too much of your time again, I just wanted to also find out what support do you currently need from like the Baller Mom community? Like any support or any information that you need from us to help you out, you know, get spread the words and everything. Of course, I'm going to share this and tag it and all. And you mentioned one program that you have, which is the back, you know, the Better Back Posture one. Do you have any programs for athletes? And if so, like what's the age or how can we get out to sign up?
As of right now, I don't. That is definitely something I would love to do in the future. Okay. But the most, I mean, for me and this particular community, it's just to kind of like, I want to be part of the prevention, right? Okay. Like I want to be part of the preseason. If it's coming to clubs or, well, COVID, I'm not sure, or even doing things online just to educate people, like doing a full, you know, half-hour session on picking the right shoe, identifying foot type, like those things you can do online. But that's where I really want to get in. I want to get in front of those people who put together the program so that I can be included in the program. So that's what I would love to do, because I want the more prevention, the less reaction, right? Like the less rehabilitation. So let's start there. Let's get in front of these kids, and parents early in the season so that we can talk about sports-specific prevention.
Exactly, and I think that's great because for us, we want to make sure that they last long through the season. You don't want to be out of the season due to injury.
Exactly.
I mean, getting hit on and going on the floor is something that can happen because it is a things we can't prevent.
Absolutely.
But like you said, if we can start early on identifying how to treat it prior or even after, so that the length of pain doesn't last that long.
Yes, exactly.
Right? So we're not out for because I want to be on the sideline. I want to scream. I want to yell.
Yes, of course. Right? Of course.
So those are good things. And definitely, so for those that are watching, Dr. Remy has a practice here in Toronto, Canada, in Mississauga. But she does have a virtual program as well, too, that you can sign up to. That helps you yourself, you know, with your posture or even with your kids, whenever they're sitting down to keep being active so that we can prevent any further injuries in the future. Now, when it comes, I know you don't do the physio and all, but when it comes to stretch,
it's part of what I do.
I'll often overheard, you know, once you feel the pain, that's how you know it's working. Is that true?
Stretching should be uncomfortable, not painful. If it's painful, stop. You're doing too much. It's not the right stretch. There's a difference between hurt and harm, right? So yes, a little discomfort is okay, but pain is not when you're stretching. No. So discomfort, yes. Pain, no. Okay.
And when it comes to hydration, in addition to the treatment, what are some of the things that is it just water, or it's like Gatorade or Powerade? Like
I mean,
because water will help to determine how we're healing.
Temporarily help. I mean, I'm not a nutritionist, so I don't speak too much on nutrition. But in terms of hydration, you want to be hydrated. You want to make sure that, I think even for adults, you should be having 1 ounce for every, is it 1 ounce for every pound? Oh God, there is a calculation. I just completely forgot what it is. But you want to be, like the Gatorades and things like that, they have a lot of sugar. So you have to be careful with that, right? Because sugar is a temporary high, but it's followed by a crash, right? So you don't necessarily want that. But you just want to stay hydrated throughout the day. You want to, and this is where nutritionist comes in, talking about like pre-game meals, you know, making sure you're having proteins and things like that. So that is another that can be a whole hour session on its own.
I would someone soon on that.
I think that they're better to speak on it than me. But I always say, if you are injured, just increase the water intake because your body is repairing, so it will need more water for that.
Water with it. Okay. Oh my God.
Yeah.
These are such great tips. Like I've learned so much. Like,
excellent.
And I feel so good now, not knowing that, hey, like you said, have someone in, you know, in your pocket, have not just a general practitioner, but have a doctor, someone that specializes in that particular part of the body, especially now that the kids are being very well active, and for ourselves too, right? So where is your office located, and how can we reach out to you?
Yeah, so my office is in Mississauga. To be honest, the best way to reach out to me is just on Instagram because I do check it on a regular basis. But if you go on Instagram and you hit on the contact button, it will take you to my email, so you can also email me. But yeah, you can definitely just follow me at Dr. Nekessa Remy on Instagram, and feel free to message me there.
Yes, great. And last question. I think in my previous discussions, I didn't get a chance to do, but I always like to run off my conversations with just non-topic related, but just general to just relax us and make it more a little bit more fun. So what is, because you've been in this field for so long, you're a mother now too. Even if you were playing sports before, anything like that, you're always advising people. You're always telling them and guiding. What is one of the best advice that you yourself have received?
The best advice I ever got, and it's so funny we talk about this because I just posted about it today, is to dream big. Because, I mean, as a chiropractor, I never thought that I would be working with athletes in this capacity, educating them. You know, I always thought I'd have a clinic, people would come in, go out, that's it. But now, especially because of COVID, I'm speaking to large groups of athletes, and I'm able to help people outside of my office. Like, I'm not confined to these the four little walls around me, right? Like, and because I've been educating people, it's led me to do TV. Like, I get to do morning TV sometimes, which is awesome, right?
7 o'clock.
Yeah, so I think, oh, thanks. So I think that's so important for young people, for anyone. Dream big. Like, you never know where it's going to take you. If you work hard, you prepare, just have those dreams. Have those dreams that you might think right now are impossible. Dream it, because you never know where life is going to take you.
And we're there to support them. We're not restricted. We're just letting them be. You know, you're not living my dream that didn't go through. You're going to dream your dream, and we're there to support you. And I think that's what most of us, in terms of sports parents, want. It's not our dreams, but we want them to be able to continue to do what they want.
Yes.
Wherever it takes them, however it takes them. So it definitely.
Absolutely.
And for, the athletes watching, even if you're the athlete, you could still be in sports and be a chiropractor, be an acupuncturist, and still be in the sports of your choice without having to be just an athlete. You could be a coach, a trainer, you could be anything. With that said, I think that's a great advice. I would like to end it off there. Do you have any other last words you want us to know about you? And can we see your daughter too? I know she's been very helpful. Hopefully everything is done by now.
I don't know. She's in my bag. Sammy, you're going to come say goodbye? You're going to come say goodbye. Come say goodbye. But yeah, I think right now, not much to say other than just thank you. And I think having conversations like this with parents is so important. It's so important because one advice I'd give to parents of young athletes is just because the pain goes away doesn't mean that your child is cured. I think that's really important.
That's important.
Because pain will go away, especially in kids. They're so resilient. They're so flexible. Like, pain will go away. Yeah. But if they're not able to do certain things, you got to get it checked out. Okay. You got to get it checked out.
Okay. Wow.
Yeah.
You will. And
I think my daughter is too busy in my wallet right now.
That's okay. We'll be
taking out my money.
Yes. I'll connect you with Mr. Scott as well, and you can share his audience who are all over in US as well too.
Yes.
And let's get, let's spread it out because like you said,
I appreciate that. I love doing this thing.
Yeah, you're doing good.
I love doing it.
And I'm looking forward to your own show for sure.
Yes, I want that. That's my big dream. My big dream, my own health and wellness show. Yes.
For sure. So thank you so much.
Thank you.
Everyone that tuned in, thank you so much. Have a good rest of the night. And stay tuned as I'm going to be posting this on our IGTV and YouTube for you to watch. Go back, rewind, take notes as needed. All right. Thank you.
Have a good night.
Bye.